our chairman, Councilman Scott Black from the city of North Las Vegas, and also our vice chairman, uh, Commissioner Marilyn Kirkpatrick from Clark County. I will make a brief comments, and then I will ask Councilman Scott Black and Commissioner Kirkpatrick to make some statements as well. First, I want to share with you that until today, there have been more than 370,000 doses of COVID vaccine administered in Clark County. 266,000 of those doses are first dose, and 103,000 are second dose. So what it means is that right now, more than 10% of Clark County population has received at least one dose of COVID vaccine. As you know, we are administering the vaccine in phases, and those phases are consistent with the state of Nevada playbook for the vaccination campaign. Right now, in Clark County, we are offering the vaccine to those who are 65 years old and over, and also those who are within the frontline community support as we define in our website. I also want to share with you that last week, because of the weather conditions across the country, we didn't receive the the allocation of vaccines that we were expecting. Specifically, our allocation for Moderna was affected, and because of that, we had to cancel some second doses appointment last week that are being recovered during this week. The good news is that yesterday we received the allocation that was pending from last week, so we are good on that regard. And also, we are expecting this week allocation for vaccine, both Moderna and Pfizer, most likely tomorrow. We also want to share with you that we are offering first and second dose appointments at the Cashman Center, as well as at the Las Vegas Convention Center. Uh, Currently, the Cashman Center has a limited number of first doses available appointment, and also are offering appointment for the second dose of the vaccine. We encourage everybody to try to get an appointment for the vaccine, as opposed to going to the site and just walk-ins. But however, there are still limited number of, of capacity for walk-ins at our Cashman Center. Uh, the other thing that we wanted to share with you is that this week the health district had the confirmation of our eighth case of the B117 strain, which is the the COVID strain that originated in the United Kingdom. This is a male in his 70 years old, a Clark County resident. So far, this person is not admitted to any hospital, and is recovering pretty well. Uh, the thing that I want to emphasize is that even so, we are in the middle of the vaccination campaign, and we are, you know, really working hard with our partners of the state and the federal government to to expedite the process of the vaccination campaign in the community, and a lot of effort is being directed towards that campaign. we cannot forget the importance of testing. And testing is one of our most important tools, because by testing, we are able to identify cases that otherwise could be still spreading the disease in the community. We in recent weeks we have noticed a decrease in the number of testing, so not as many people are coming for testing. We want to emphasize that it is still important, even so we're vaccinated, but also uh, to to emphasize as well that testing is free of charge. So regardless of whether you have insurance or not, you are not being charged for testing. So it's important to remember that. And I will stop here. I will ask Chairman Scott Black, please.
Thank you, Dr. Legan. You know, as been noted, the case counts and the test positivity rate continues to decline in our community with COVID-19, and that, along with all the individuals that are taking the opportunity based on their employment or their age group to be vaccinated, we're making some significant progress in our fight of COVID-19. But if you travel around our community and you see the large flags waving at half staff, those are indicators of some sober milestones that have been met in recent days. Unfortunately, throughout our nation, over 500,000 people have lost their lives to COVID-19. Here in Clark County alone, over 225,000 individuals have contracted the virus. And unfortunately, we've lost over 3,800 individuals to COVID-19 in our community alone. You know, you think of these numbers and they're quite staggering, but behind each number is a person, is a family, is a doctor or a nurse who labored intensively to help these individuals just to lose the battle to this disease. We have impacts on our school children, on our businesses, on our economy. And so it's really worth noting that this battle is not over, but we're fighting a good fight and we are making progress. Things are starting to look up. And I just wanted to say on behalf of the individuals on this call today, to say thank you to you and the community for looking out for and protecting yourselves, for doing things that are uncomfortable and out of the ordinary to protect your family and ultimately our community as a whole. And as more people get vaccinated, we're going to continue to make progress. But I just wanted to note that vaccination is really only one component of our overall strategy to fight this pandemic. So please don't take the eye off the ball as far as hand washing, as far as distancing. Don't go places if you don't feel well. Let's just do the things that we've been doing over these past many months, in addition to getting vaccinated when your opportunity comes along, and we'll get past this. So thank you very much, Dr. Legan.
Thank you. Okay, I will ask Commissioner Kirkpatrick, please.
Thank you, Dr. Legan. And first and foremost, I just want to say thank you to our community for coming together. We have hundreds of people that are working around the clock to ensure that we have vaccines, testing, and our regular duties at the health district that we're keep moving forward. So couldn't be more proud of all the work that is being done in Clark County. I want to remind constituents that it's very important that you get your second shot. We have plenty of second shots available. Thank you for your patience while we rescheduled, but now we have plenty in the house and we encourage you to get them. It is very simple process now for 65 and over to make appointments. We are fortunate to have so many community partners across the valley that you can almost go anywhere to get signed up for a vaccine moving forward. So can't thank everybody enough. And I see a light at the end of the tunnel, and we're all working to ensure our community stays safe. So thank you, Dr. Legan, and our emergency management and everybody at the health district who's working around the clock to work with us.
Okay, thank you, Commissioner. Okay, Corey, would you please go to the questions?
Yes, sir. At this time, we'll open it up for members of the media to ask their questions. Please use the raise hand feature if you would like to ask one. It's one question per member of the media. The raise hand feature is located at the bottom of the participants list, or hit *9 if you're on the phone. And our first question today is from Mary Hines. I'm unmuting you now.
Thank you. Good afternoon. Do you believe that all of those people 70 and older who wanted to be vaccinated were inoculated before you got to the next group, the 65 to 69? And when do you think yet another group will become eligible? What's your best estimate?
Okay, I will start on this one. Well, thank you for the question. Actually, we are far over the 50% of that population being vaccinated already. I'm referring to the 70 years old and over. Um, we decided to move into the 65 and over last week because we we noticed a decrease in the demand for vaccination among that group in our sites, and then what we did was expand our scope to 65 and over, which doesn't deny the service to those who are 70 years old and over. Still, they are eligible for vaccination, and we are looking for them to get vaccinated, but we decided to go over and expand our scope. Uh, I missed the second part of the question. Oh, when would we move to another group? Well, we we first need to address the 65 and over, and also the occupational groups that we are working now, as well as feel comfortable with the vaccine allocations that we are receiving here in the county. Still, as you know, last week we missed the shipment, and now we are trying to recover from that. And once we hit a comfortable number on those areas, then we might move forward to additional groups in coordination with the state. Thank you.
Before we move on, we had a follow-up on that, or a clarification question on that in the chat box. Did you say that 50 to 60% of the 70 and over population has been vaccinated?
Yes, that's correct.
Okay.
Over 50% of them.
Thank you, sir. Our next question comes from Joe Moeller. Oops, hold on. Okay.
All right, this is Joe Moeller from 8 News Now. And I kind of have two questions that kind of go together. Last week, or the week before that, there was significant delays with people at the convention center. And we did follow up with people at Cashman. They said there wasn't any delays there, but what's being done to ensure that people aren't going to be waiting for 4 hours, especially with Johnson & Johnson moving forward and that vaccine potentially rolling out here in the next few weeks?
Okay. You want to take that one?
Sure. So when there were long waits, we had opened it up to walk-ins, and that's because we had capacity that we needed to fill, and we were seeing people not showing up for their appointments. So we opened it up to walk-ins, and then we got in trouble because we had too many people show up. So we have worked through that. We no longer take large amounts of walk-ins, and we've also have a system. If we do walk-ins, we have a system where people get wristbands, so many per hour, and then they can come back at a later point. So we work through it through workflow, and then also trying to help people get to their appointments. So with that note, it is really important that people do come and get their second dose, make appointments, and then if you need to cancel, let us know. Right now we are switching systems, so the best way to do that is through email or phone number, and I have those in the chat box.
Chief Castle, do you have anything to add to that?
Yes, I do. So on that day, we had those really long delays. Another significant contributing factor was the Wi-Fi went out at that facility, and we were unable to access any of the records and the ability to get people in to get their shots. And when the Wi-Fi came back on, unfortunately, a software update from one of the vendors used to support this project they pushed out this update that took like 40 minutes to process. So we lost an hour of productivity, which backs people up. So on that day, we did have some very unfortunate waits. By the end of the day, we had caught up for the most part. We went from 3.5 hour waits to an hour and a half towards the end. And though we typically run about an hour and 15 minutes on those sites when they're running at capacity. So which we feel is it's long, but everybody's waited for a doctor or appointment or so. It has had to wait that same time. So, but that was a big problem on that day when things really were backed up.
So Joe, this is Marilyn. I want to highlight a couple of things. So we are really, we're really in a good spot. So across the country, they have everybody's worked to try and tweak all their different venues on what works best throughout the country. But here in Clark County, we're constantly every day seeing how we can make it better. So at the convention center, we've pulled in some seating for some of our groups. We're giving out the wristbands. We have carts for our elderly. We've opened up handicap lines. So we're continuing trying to make it as easy as possible and as comfortable as possible for folks to do that. And with all of our partners, your Walgreens, your Smiths, your all of those, plus Southwest Medical and our mini pods across the valley, we've really tried to make it so that people can figure out what's the best scenario for them. I mean, look, we have a great story from yesterday, right? We had a 75-year-old person who needed to get her second shot. She normally takes the bus. We were able to work with their family to get her there. And then we were able to actually take her, and she couldn't have been happier with the process. And there's a lot of those stories out there. So the one-offs that happen or the unexpected delays, we really are, we're really getting good feedback from folks. And we take constructive criticism, but I will tell you that there's nobody on this call here today that is not always trying to think of how we can make it better.
Our next question today comes from Mike Shoro.
Hi there. Thanks for taking my question. So the Southern Nevada Health District did begin rolling out a new vaccine management system this week. What has the response been like? How has it helped for the process of getting shots in arms and speeding things up? Any glitches, bugs? What's the response been so far?
Okay, Joanne, would you please explain the Salesforce?
Sure. So Salesforce is a platform that the state is providing. And so we're the first ones to go on the system. Go live was just yesterday, so we haven't had a lot of experience, but it went pretty well yesterday. We were able to get some vaccines in and people were able to schedule. So far, so good. There's bugs that need to be worked out. This was a project that was done in 3 weeks. So if you know anything about implementing programs like that for healthcare, that's pretty amazing. So it's going well so far. I was just checking online to see if I could see how many appointments we had here at Decatur, and it wouldn't let me go through because I didn't know when my first dose was given. So it has some checks and balances that will give information to residents that on how to obtain their vaccine. So I think it'll be really good.
Okay, we've got a question in the chat box from Mick Akers from the Review Journal. He's asking, I've been in contact with various people in the sports industry who've addressed concern about fan capacity. 3 of the largest venues, Las Vegas Motor Speedway, Allegiant Stadium, and T-Mobile Arena, haven't been approved for the announced 20% capacity. What goes into the decision? Does anyone actually go to these events to get a firsthand look? And if the largest event centers in the state can't attain the 20% capacity, what is the reasoning behind announcing that?
Thank you. Thank you for the question. Well, we have our environmental health team working on looking at the plans for large gatherings, and they work in coordination with state agencies and the Gaming Commission. Our decision to limit those gathering to 15% is because those are the very first events that we have here in the county after almost a year without large events. We need to make sure that our surveillance and response capacity to those events is properly allocated, and we have the resources to respond to those new situations. So for us, those events being the first one, we don't want to risk the possibility of having to deal with large outbreaks or issues related to those large gatherings because our teams are not prepared for that. So again, those are the very first one, and we look at those more as pilots to help us understand where we are and how prepared we are to respond to that. I will have to mention also that yes, we are approving a 15% capacity, or I would say recommending, because we are not the final approval as a source, so we are recommending 50% capacity. There are other states across the country that have limited that capacity to 10%. So just tell me. Thank you.
Our next question today is from Jacqueline Schultz from Fox 5. Trying to unmute you, one moment. There we go.
Hi, Doctor. Can you elaborate on that? Like what exactly the health district is going to be doing at those games? In terms of surveillance, fans coming in, is there anything that people on the ground are going to see differently in terms of practicals? And then if you could shed any more information on the 8th UK variant and any of their contacts and prior exposure to other cases.
Sure, certainly. Well, what we're doing is our environmental health inspectors, they will visit those venues, and they look at the distribution of people on site. Also, they look at the people, whether they are wearing masks or facial covering. Also, they are looking at the social distancing among the participants of the events, and some other elements that they have in the checklist of what they need to look for an event to be successful in terms of prevention and mitigating the possibility of transmission of disease at those places.
Okay, at this time, here's one more question from Michael Davidson.
Can I?
There you go.
Okay, thank you. Appreciate it. Sorry, I just wanted to make sure I went near the end since we already had some of our reporters ask questions. Didn't want to cut anyone else off. It's been a few weeks since we doubled down on our commitment and efforts to have an equitable vaccine distribution. I was just hoping that the health district could maybe highlight some of the things that efforts we've seen this month, and talk a little bit about kind of what's going on, maybe if there's any specific vaccine clinics, pop-ups that are targeted towards communities of color, for example, or whatever the actions y'all are taking right now in the past few weeks. If you could just kind of give us a rundown of that and how it's going.
Sure, thank you. Well, first, I want to say that we have been partnering with the community just to mitigate this inequality that is being observed in the early stage of the vaccination campaign. I want to say as well that the way that the vaccination campaign is designed, especially in the early stage of the campaign, doesn't give you a lot of room to eliminate this equity issues in terms of vaccination distribution, because the only area that we really can address that is within the age groups, as you know. So having said that, we have met with community leaders of the zip code, the areas where we have the highest incidence of COVID through this pandemic. And we have agreed with them on providing this service to that area, and also asking them to help us identify community members who are eligible for vaccination, and then granting them access to the registration system in a way that the initial allocation of space for vaccine administration is actually directed to members of that community. Once we are very close to the event, then if we don't feel comfortable with the number of people registered, then we open up to the rest of the Clark County at large. I will ask Chief Cassell to provide more information on those sites and what we have been doing there. Thank you.
Yeah, so for instance, thank you. For instance, last week alone, we had sites at Desert Pines High School for 4 days. We had Chuck Minker, that was run by the city of Las Vegas, one of our partner agencies. They were there, also there for 4 days. And we were at the Pearson Community Center for 4 straight days. And those sites were very busy in that heart of some of the districts that we need to get to. But one of our challenges is when we were tied to a certain tier of people to be allowed to vaccinate, they come from all over the valley. Your higher residents of your higher populations of 70s live in areas more on the periphery, Anthem and Sun City, Summerlin, things like that. So that's why it appeared as if certain groups were, certain areas were being targeted or are getting those vaccines over others. However, it's just the percentage of people that lived in those areas that met those tiers traveled to those sites and got those tiers or got those shots. We did, especially at Pearson, we used some of our friends in the church community over there, and that have been born and raised, and several of my friends went out and targeted specific groups and got them signed up before we opened it up to the public, so that we could get more of that community into that site. So we did make some progress on that. It can always be better. But we did as well as we could.
Dr. Legan, I'd like to make a comment, if I may, regarding this topic.
Please.
For the last 2 Saturdays and Sundays, we've had a team assembled from the city of North Las Vegas, comprised of our assistant city manager, Alfredo Malesio, as well as some police and fire explorers out at Broadacre Swap Meet, passing out flyers in Spanish, trying to reach the Latino community. We've also done this each day during the week at La Bonita supermarkets, both locations in downtown North Las Vegas. So there is a wide variety of unique and proactive efforts, as Chief Castle mentioned, and what I'm talking about throughout the community to try to reach areas of the community that definitely need the vaccine, that need access to it, that need to have some reassurance and education regarding the safety and efficacy of it. And I think it's working. I really do. This grassroots marketing effort that we're doing just by kind of old school, really handing out flyers face to face, having conversations in Spanish, with these individuals out at these sites, I think will make a big difference.
Thank you.
In our chat box, Rhonda Prast asked this question: how soon could a drive-through option be available for vaccinations?
So I'll discuss that. So on the vaccination site, the Toro, some of the private partners are doing drive-through vaccinations at certain locations. One of the things we are looking at is partnering with RTC in the next few weeks. They've got a lot of availability of buses and drivers to where we can have them go out and pick up people in certain areas at collection points, so to speak, and then drive them to a mass vaccination site. We can then vaccinate everybody on that bus. There'll be about 30 people social distanced on the bus. And then they would take them back to where they picked them up. So that's one of the ones we're looking at. As far as an actual drive-through, a mass drive-through, that is kind of on our radar going forward, but we're just not there yet. We're able to handle what we're doing through our mass vaccination walk-in sites. And we are looking at if we can get the staffing and the support to do so, to open up a third one.
Thank you all. At this time, I don't see anybody else with any raised hands. So in a couple of minutes, we will move on to the Spanish portion of our day. But if anybody has any other remarks while we're all here, please go ahead. And seeing none, we're going to have a great afternoon. Thank you all for joining us today. And if you're with the Spanish-speaking media, please raise your hand and we'll get to your questions with Dr. Ligon. Thank you. Alexander or Telemundo or Univision, please raise your hands if you have any questions. Oh, okay, let me unmute you, Alexander.
Dr. Legin, ¿me escucha?
Sí, cómo no.
Sorry, I had a hard time trying to raise my hand with the app.
Sure.
Okay. Doctor Legin, me interesa mucho esto de los eventos masivos. Solo para verificar algo, dijo que 370,000 personas ya han sido vacunadas hasta ahora, de esas 266,000 con una primera dosis y 103,000 con una segunda, ¿correcto?
Oh, disculpa, tú puedes repetir la pregunta, disculpa.
Sí, a ver, solo para verificar un número antes de hacerle la pregunta. Dijo 370,000 vacunadas, dosis administradas, ¿correcto?
Sí.
Ok, quisiera que hablara un poco de los eventos masivos. Me llamó mucho eso la atención, doctor. Dice que van a trabajar a un 15% de la capacidad y que ustedes están trabajando con una agencia del gobierno. ¿Podría ampliarnos un poco más esto de los eventos masivos y cuáles son y qué están trabajando y qué están haciendo ustedes como Distrito de Salud?
Sí, gracias, Alexander. Bueno, el trabajo con los eventos masivos es algo que nosotros hemos estado haciendo desde meses atrás en coordinación con las entidades del Estado, o sea, oficinas del Estado, de este caso, la oficina que se ocupa del Departamento de Industria del Estado, la Comisión de Juegos, o Gaming Commission, como le llaman, y nosotros lo que hacemos es que nuestro equipo de inspectores ambientales, igual que los que hacen vigilancia, ellos evalúan los planes que distintas instituciones tienen para desarrollar eventos masivos, o sea, eventos grandes. Ellos revisan el plan que tienen estas instituciones, cuántas personas ellos están pensando traer a ese evento, cuál es la capacidad total de la instalación, cómo es el movimiento que ellos prevén para la entrada o salida del personal en estos establecimientos. Así que cómo las personas se van a sentar y toda una serie de elementos que forman parte de ello, igual que el uso de máscaras para protección de los participantes, la distancia social o los 6 pies de distancia entre participantes, y o sea, toda una serie de medidas que son parte de medidas para mitigar o disminuir la posibilidad de transmisión del virus en un evento masivo. Es lo que nuestro grupo mira, y eso también se mira en comparación con cuál es el estado de la transmisión de enfermedad en la comunidad. Y entonces, en base a eso, ellos hacen una recomendación a las agencias, en este caso estatales, que son las que finalmente aprueban o no un evento. Nosotros no aprobamos eventos, nosotros solamente recomendamos o no si un evento debe ser aprobado.
Y se habla de un 15%, ¿correcto, doctor Leguén?
Sí, nuestra recomendación es basada en que decidimos que un 15%, por lo mismo que dije anteriormente, porque nosotros tenemos preocupación por el nivel de transmisión del virus todavía en nuestra comunidad, aunque el virus tiene una tendencia decreciente y está bajando bastante rápido, todavía existe un nivel de transmisión relativamente elevado en nuestra comunidad y por tanto nosotros tenemos la preocupación de que eventos masivos con demasiado excesivo número de personas puedan contribuir a que se presenten nuevos brotes de la enfermedad en esta comunidad.
Just a final question. Doctor Leguén, sabemos que hay una noticia sobre la vacuna de Johnson y Johnson. ¿Podríamos tener alguna información de eso? ¿Cuándo esperan ustedes que quizás pase? Quizás mucha gente se pregunta cuándo podríamos tener esa vacuna acá en el sur de Nevada. ¿Hay algo que nos pueda decir al respecto?
Bueno, nosotros tenemos la misma información prácticamente que tienes tú. O sea, la vacuna fue sometida a la FDA, que es la Institución Federal de Alimentos, que ellos la revisaron. Pasó, digamos que la primera etapa de la revisión todavía no está recomendada o sea, autorizada para el uso, pero ya pasó la primera etapa y se espera que en los próximos días ya el comité de la FDA le dé el apruebo definitivo a esa vacuna. Ya una vez que tiene esa prueba, o sea, el apruebo, ¿cómo es? Aprobada para, o sea, lo que se llama la autorización, ¿no? Entonces ya ellos pueden distribuir la vacuna. Lo que se espera es que ellos se demoren 3 a 4 semanas en tener un número aceptable de dosis que puedan distribuir en el país. Pero en realidad nosotros no esperamos ver la vacuna aquí por lo menos en las próximas 3, 4 semanas.
Thank you, sir. We have no further questions at this time. So that should be the end. I'm sorry.
No, no, because I saw something from Scott Black. He wanted me to share with the Hispanic community, but
Oh,
okay. Sí, en la ciudad de North Las Vegas, ellos están anunciando que ellos tienen en este momento un número elevado de citas disponibles para la vacuna, tanto mañana jueves como el viernes y también a principios de la próxima semana. O sea que las personas que viven en North Las Vegas o en otras áreas de aquí del condado y no tienen citas para vacunarse, pueden registrarse en el sitio para North Las Vegas y allí todavía hay espacio disponible. Okay, Corey.
all right. Thank you all for joining us today.
Okay, thank you.
Hold on, let me just double check. Did anybody else have a question? Raise your hand or send us a message. See, we do have Univision Colorado and Telemundo on here. So I'll give you just a moment. Okay. Neither one has raised their hand, so feel free to email us any questions you may have, and we will see you all next week. Thank you.